This meeting is being recorded.
Yes, it is. So, and so we are recording, and I will send this out to everyone as well. Well, thank you all for joining us this morning. Webb and Miki have been having lots of conversations with lots of different people over the last 6 weeks. And they're here with us this morning to talk about some of their observations, some of their findings, and maybe some preliminary recommendations, or at least some thoughts that they will share with all of us. And they're seeking some direction and some reaction to that. So Webb, Miki, all yours.
Thanks so much, Ray. I think that's a great summary of our agenda for today. And also thanks for putting this meeting together. And thanks everybody who has called in. So as Ray said, we're going to give a couple of updates. And then I think we'll spend most of the meeting today looking at service alternatives. And here we're thinking about alternatives as specific transportation options for the county. So we'll look at that in our mapping software, and I'll be asking for input throughout. We're really curious to hear if these are services that you think would be useful, if you think people would use them, or if it seems like something that might not be useful, something that people might not use. So we'll definitely appreciate any feedback this group has on our service alternatives. So just as a quick reminder of how this project is scheduled and what tasks we're going through. We started out with an existing conditions analysis, which we have wrapped up. We are currently still doing stakeholder and public engagement activities. The county committee meetings, which is this meeting, is part of that task. We're also conducting interviews with stakeholder individuals and organizations, and we are going to interview likely writers of public transportation service. But what we're really going to focus on today is this first bullet under task 3, which is identify transit service alternatives. These are going to be really important for us in the project because we will then use these for task 4, where we will simulate them using our fixed route scheduling technology and our microtransit simulation technology. And we will develop costs for each of those, which is obviously quite important in this project. So the point of today is basically to select services that we will model and develop costs for. So just to briefly summarize some of the key themes that we've been hearing in our stakeholder engagement, I'll just kind of go through these relatively quickly. We've heard that residents have a really pronounced need for traveling between cities and also to towns outside of the county, particularly Oneonta and Binghamton. We've learned, that towns are relatively small and people often need travel assistance to access other towns, but towns are about a 30-minute or often 30-minute driving distance apart. And when we've asked if people would be more interested in transportation assistance within their communities or between their communities, we've consistently heard that people are more in need of options between communities. We've also learned that seniors, those with chronic medical conditions, and low-income people and people seeking employment have the greatest need for public transit and are the most likely to use public transportation. And we've noted that any proposed service would need to meet the needs of these residents. And I think something to point out here is this is obviously a pretty wide group of people. So this basically means that we would be designing public transit for the general public and for people who could be using service for a wide variety of reasons, rather than focusing on only seniors or only people with medical transportation needs. We want to make sure that this is a service truly available to everyone. One other thing that's been coming up, and we've been having a few conversations about this, is the need to designate an official public transit provider. So Delaware County doesn't currently have a public transit provider, but there are several organizations who provide some form of transportation service in the county. So one thing we want to think about in the context of this study is who should be the public transportation provider for the county. And we have some questions on this later on in the meeting today. And then one other thing that I'd like to note that I think is actually pretty optimistic is that a lot of funding is going to be available for public transportation in Delaware County. So the federal government provides a lot of funding for transit through the FTA, the Federal Transit Administration, and New York State also has a really generous funding program called STOA, which is State Operational Assistance, for funding public transportation. So basically the point here is that Delaware County's local contribution or the local match required to provide public transportation could actually be quite low. And we can, get into more specifics of what that would look like. But the significant majority of funding for public transportation would come from the state and federal government. Maybe I'll pause here. Does anybody on the call have anything they'd like to add to this list? Any questions about the conversations we've had, et cetera?
Just one quick thing. So in order for a public transportation system to work though, and for STOA to actually be a beneficial funding source, you need to have riders in those seats. And so when we first identifying who those riders are going to be and what the potential volume is probably, something that's pretty important. See, because in the city of Oneonta, they have a busing system. And the only reason it's able to stay even functional is because the colleges are utilizing it. So those butts in the seats is what's bringing in the money to keep that thing afloat. Otherwise, it would not be able to sustain the local market that's available.
Yeah, I think that's a great point. And definitely thinking about, ridership modeling is going to be something we do with these alternatives. And that'll be a big factor that we look at when making recommendations, not the only factor, but a large one. We will also meet with the State Department of Transportation as a part of this project to think through what STOA funding looks like in the first year of service before there is proven ridership, et cetera. So I think that's a good point. Any other thoughts before I move on? Okay. So here we're going to provide an overview of the alternatives that we've thought about so far. So we're kind of thinking about alternatives in 3 service categories. So these are modes of transportation. We're thinking about fixed route services, hybrid or barbell services, and microtransit services. So the first fixed route is pretty straightforward. This is a traditional bus service that has set routes, stops, and timetables. And we think this kind of service would be most useful for providing service between multiple towns. The second type of service we're thinking about, some might be familiar with because it's somewhat similar to the service that the County Office for Aging currently operates. So we've called this a barbell just because it kind of looks like a barbell. But the idea here is that a vehicle would, in the morning, make pickups within a certain zone, make a scheduled run to a second town, and then make drop-offs in that zone before then making a return trip in the afternoon. So the idea here is that it's somewhere between a fixed route and an on-demand service because the service plans to make a scheduled run between 2 towns in a given day, but it also picks people up at their addresses and drops them off at their destinations at the two zones on either side of the run. And then the final category of service we're thinking about is what we call microtransit, might otherwise be known as demand responsive transportation or on-demand transit. And basically how this works is that it's an entirely on-demand service that operates within a zone. So there are no fixed routes or schedules, and customers are required to call or use an app to reserve a seat in advance. And we think this is most useful as a truly on-demand service, probably within smaller areas or smaller towns, but it could also be an option for larger areas on a pre-scheduled basis where customers are asked to reserve their seats further in advance. So we'll get into some more of the specifics of that when we look at specific alternatives, but these are just the types of services that we've been thinking about. Any questions or thoughts about what these are, how they operate, or kind of initial reactions?
I have a question. It's Dottie. Would these then kind of work in conjunction, possibly like microtransit to a barbell situation, you know, to get them from one place to, say, the barbell.
Yeah, that's a great question. So I think definitely these should be compatible. So, or could work together. So for example, you know, maybe a fixed route like would go up to Oneonta or up to Sydney. And then in Sydney, there's a microtransit service that somebody could use for a second leg of their trip.
Okay.
Or perhaps a barbell service could, you know, work like microtransit on one end of it. So I definitely think we can think about these, you know, working together.
Okay. Thanks.
Any other thoughts or questions on these? Okay, I will move forward then to the specific alternatives we're looking at. So this is a kind of long short list, but this is our current short list of service alternatives. And I will show what these look like on a map as well, because I realize this is not the easiest format to kind of conceptualize everything we're thinking about with. I should also add, if anybody on the call has any services they think we should add to our short list, we definitely want to hear that input. This is what we think is probably like the highest priority set of services, but we can definitely add more. So for the fixed route services, and these are the kind of traditional scheduled fixed routes, we're looking at routes between Walton, Delhi, and Oneonta, between Hancock Deposit and Sydney, Sydney, Walton, and Downsville, and then also looking at a service between Sydney and Oneonta. Some people may know that Otsego County currently operates a route that kind of does this, but it doesn't really go all the way into Sydney. So here we would think about actually working with Otsego County to perhaps modify that route and perhaps offer them some funding to provide better service into Delaware County. The barbell services, I won't read all of these, we can look at them on the map. But the idea here was basically to find two towns, so like pairs of towns that are located relatively short distances between each other, that are population centers where we think people might actually have a need to travel between the two towns. So we'll definitely be interested to hear input from this group when we're looking at these pairs, like, do you think this is actually a trip that people would need to make, travel between these two towns, et cetera. And please also let us know if there are any that you think we've missed. And then looking at microtransit, the first option that we have thought about is actually a county-wide service. So this would obviously be like a really large zone, which would function on a pre-scheduled basis. So in an area as large as Delaware County, this would probably mean that customers are required to book their trips 24 hours in advance. But this is basically would be a general public demand response transportation service where customers are picked up and dropped off at origins and destinations of their choosing. So that's one option that we're thinking about. And then in terms of other microtransit options, which would operate in smaller zones and function on a more on-demand basis, which is where customers book trips when they need them. We're looking at the Route 10 corridor between Delhi and Walton, and then also at a zone including Margaretville and Fleischmann's, just because those two communities are relatively closer to each other and might function as a single zone. So this is a lot of text. I will pull it up on a map, but does anybody have any initial reactions, I guess, to this short list?
It's Dottie again. I don't mean to be the only one talking.
No, we appreciate it.
So I'm just curious, being the healthcare person on this committee, would Cooperstown for Bassett and excuse me, Binghamton, Johnson City be included in that microtransit? Is that where you're thinking of that? Because that's where people are going for their all their specialty care and a lot of healthcare needs. So that's kind of missing from this, unless it's in there.
Yeah, so I think that's a really good thing to bring up and something we've definitely been thinking about. We, have learned through our conversations that there are some non-emergency medical transportation options available to Delaware County residents through organizations like Get There and Delaware Opportunities that do sometimes make trips to Binghamton and to Cooperstown. As we were looking at, regular public transit services, just because Binghamton is like a pretty far distance away, we had a hard time thinking through an efficient way to do that. So we think that need might actually be better served by other non-emergency medical transportation options. But with a public transportation provider in place, that provider could basically help residents access those other services or kind of serve as a point for like trip coordination. So that's kind of how we were thinking about trips to Binghamton, but I guess I'm curious to hear your reaction to that.
Okay, well, I guess my first reaction is I don't feel like that's enough. Because the existing transportation, unless I'm misinformed or misremembering, which I could very well be, I believe it's all for low income that's available. So we still have those people that just can't drive, or are afraid to drive, or the weather, whatever, that could use the service. One thing I've thought about since we've talked is, and I think UHS would be on board with helping us with this to a certain degree, is if we could have that route, and maybe Bassett would do the same to Cooperstown, a couple of days a week, so that, we could try to do our best to maybe it's 3 days, 1 week to Binghamton and 3 days the following week to Cooperstown, and the other 2 days are to the other place. That if there's a way to do that, we could probably do our best to try to schedule those patients on those days.
Okay.
Can I just jump in 1 second? So
Yeah.
all the options have Oneonta in the mix, right? Oneonta's public transit system goes to Cooperstown every day, numerous times a day. So if you're able to get them to the hub, then they basically relay off that vehicle that's being provided by Delaware County and jumping on public transit for
Cool. Okay,
costs to get to Cooperstown.
that's great.
They're running every day on a regular schedule. So it's about coordination.
Okay, that's great to know. So, but then we still have Binghamton, which of course is the system I'm affiliated with at UHS, and a lot of people on the western side of the county go in that direction. So I still have that concern. So I'm just putting it out there. It's to be discussed and figured out, later. So.
Yeah, that's really useful. And I think we can definitely think about an alternative that would provide some form of service to Binghamton. We need to think about it more. I'm not sure exactly how it would be like classified between these categories. And Al, your point that like perhaps a connection in Oneonta could be useful is a good one. So we'll make a note of that, and we'll think through like what alternative would be like best, I guess, to help get people to Binghamton.
Yeah, I think a connection to Binghamton a good connection would be like Hancock or Sydney. Those two would provide the places where you can either go down 17 or 88 easily not easily, but it's still a trip. But
yeah.
The other thing that I got to say, this one, thinking of it because I might forget completely, this idea that popped into my head. At one point in time, UHS was using a small bus that they were taking. If people got to the Oakdale Mall, where they had a Stay Healthy site, they had a small bus that would take them to the individual offices. So if we could work something out where, possibly UHS would help subsidize that vehicle being there for the day to take people between locations. It doesn't have to be our people, but to help subsidize those trips. So if somebody has to go to, the orthopod in Vestal, but then they need to go to Wilson and Johnson City or something, maybe there's a way to help subsidize some of those patients that need to go around the Triple Cities area. So it's not worth their time.
Dottie, is it, it's Ray, is it outside the realm of possibility that UHS, understanding that they have a large client base here in this county, would provide that vehicle from, say, a Deposit or a Hancock, and then bring them to the Oakdale Mall, at which point they would then distribute, rather than trying to squeeze, what could be a square peg in a round hole in what we're trying to do here?
Well, I think I can't speak for UHS.
Of course.
There's always possibilities. They're always open to ideas. So I wouldn't say no. the Oakdale Mall option no longer exists because they're no longer in that location. So that's
Okay.
not there at this point. But the other thing I was thinking is that, I mean, it's not just going to be patients that necessarily want to get to Binghamton. I mean, people like to shop in Binghamton, you know. So if they
You want them
can
to shop
get
locally.
what's that? Yes, they
I
should shop
want
locally.
them to shop in Walton and
I know
Hancock.
that. However, we don't have a Walmart in Walton. So there are people that want to go to Binghamton for other reasons. So, I mean, it doesn't have to be just strictly patients either. You know, I think that there is, and I don't know how you figure that out, but I think that, and we talked about how do you figure out the, you know, the people that would be using it. But I do think that there might be a audience to use it just to get to the Binghamton area, Johnson City, Vestal.
Sure.
And I think we have to keep in mind too, with the aging population that we have here with medical appointments at Bassett, I know what we have a hard time with in our field is that the physicians don't always meet Monday, Tuesday, Wednesday, Thursday, Friday. Some
Right.
days they meet Monday, Thursdays. It all depends. And that's up at Bassett and the same in Binghamton. So somehow we got to coordinate to make sure that they can get to the hub or to get to these facilities whenever the physician's appointments are available. That's what we're having a hard time with for the seniors. It's not like that physician sees clients Monday through Friday every day. It's different times at different.
Right.
So I think you have seen that too, Dottie?
Yes, it's true. That's why I said have it at least 2 or 3 days a week so that hopefully
Absolutely.
you could capture what are the days where they're actually working that week in their office, having office hours as opposed to special procedures or surgeries or whatever. But Wayne, am I still correct in thinking that your services are like twice, they only can have it like twice or 3 times? Is that
No, they can to use the bus.
not the bus, the medical transportation with your bone?
We use it unlimited because you know there's such a need. Whatever.
Okay,
they
so
want.
it is unlimited now for the same people?
Yep, and they have, but
Okay.
they do have to contact us within 7 days prior to their appointment, so we
Okay.
can get good time scheduling. But the other thing is that we're having, you know, you got to consider this mass transit is that the handicap population of our seniors, they're in the wheelchair or walker, can they be accommodated? And so you can take them to the hub. That's nice. But how convenient is it to get from that hub to get back on a bus, to get going to the next one, to get back? You know what I'm saying?
Right.
That's where we're having a problem with our aging population.
I think that's a good point because there's definitely, you know, a threshold at which, you know, taking like maybe an hour-long trip to Oneonta to then connect to a different service to then, you know, we definitely want to be conscious of how long each
That's
trip
correct.
is taking. So that's something we're definitely thinking about as well.
And also we got to consider is that, okay, so making sure that all of a sudden, if we get them up to Bassett and all of a sudden, is there a way to get them back home? Do you know what I'm saying? I don't know what the time schedule, so that has to definitely be made possible.
Yeah. Okay, I think this is all really useful. I'm going to go ahead and pull up our map just so that we can start putting some of this into comments on the map. So is everyone able to see my screen currently?
Okay.
Okay, so I guess one thing to preface this conversation is that obviously everybody on this call is aware of Delaware County's size, which we've heard in several of our stakeholder conversations is larger or comparable in size to the state of Rhode Island. Delaware County is really large. We're likely going to be working with a limited pool of resources. So public transportation is not going to serve every need that exists. We are going to try to design a system that meets as many needs as possible. But with any alternative, there are going to be people whose trip, whose medical need or whose specific, you know, kind of commute will not be served. So really the point of this exercise is to think about which of these options would do the most good for the most people. So that's just, you know, one thing to kind of note as we get going. But my plan for this is to kind of flip through each of the options that we have and just to solicit kind of like initial high level input on like, do you think this is useful? Do you think this is the right route? Or do you think like we should think about, or do you think that this is one that is not particularly useful? And because we have 30 minutes, I'll try to move relatively quickly through these, but definitely would love any thoughts that come to mind. So I guess I'll start with our first route suggestion, which is Walton to Delhi to Oneonta, which would make stops at large employers around this corridor, which we know is an important corridor for the county. So any initial thoughts, I guess, on this first route?
Yeah. So you're gonna go to Walton, over to Downsville or Colchester, then to Hamden, and we're talking about a bus. Is this what we're gonna be using?
Correct.
So when you go over to Meredith, are you showing this map to go to Meredith and then you're gonna go down to East Meredith and over that way to Oneonta? Is that what you're showing?
So I guess another thing here is these, we haven't like,
Shake. Where is
these
that?
are kind of initial like drafts of the routes. It's not necessarily like what the specific route would be. It's more just
Okay.
kind of conceptual, like, do we think a service serving these towns is useful?
Yeah, Webb, to Wayne's point, I think, you've pulled, I'm sure you use something like Google Maps or something like that showed the most expeditious way, and that route, I think where Wayne was going is that route is taking you up County Route 10 and down through over
23.
oh please,
23,
what's that?
23, from County Route 10 over to, was it?
It's dropping you out on 23 in Pinder's Corner, so
Yeah.
it's taking you down
Actually,
Prosser Hollow, which
yeah, I
is
was gonna say, it's taking-
not
yeah,
the
you don't wanna
route
go down
that
there in
you
the
have.
winter time.
So should we serve East Meredith with this route? Is that the?
Well, it may be. I'm actually now looking at this a little bit more. I'm wondering if the route is not to not to Meredith, but does this route continue through Delhi up to Stamford and then across 23? Or is this route coming from Meredith because you're following Route 28 from Delhi into Merridale, that it continues then on Route 28 into Oneonta? The route is, you definitely don't want to be taking anything over. I don't like driving on Prosser Hollow in the wintertime.
No, absolutely not. Absolutely not.
I guess.
And
the
you
other thing,
definitely don't
too,
want to
is-
do it with any sizable vehicle.
Especially coming down Colchester, if you're coming down Downsville, I know school buses do it, but then the roads are closed. So I think you gotta take that into consideration. And if you're looking at that route, because I can't see it now, how many miles is it? Because let me tell you, it's a long, we do this with our bus right now. And let me tell you, some of these people don't like it because it's like, we're on the bus for an hour and a half, 2 hours.
Yeah, well,
Keep that in mind, an hour, 2 hours out to medical appointment, hour, 2 hours back. It's,
but this is the situation though. You're in a rural area with
I know.
it's vast. And
Yeah.
the major concern that I see here with this route is unless you're going door to door. Well, let me just ask, is this a door to door service? Is this a
So this
door
would
to
be
door or a
scheduled.
bus stop?
This is a
service?
stop.
See, a bus stop service, getting the people even to the bus stops will be a challenge that it's an unbelievable challenge just to get them to a stop in those areas because they could be 5, 6, 7 miles just from the stop itself. It's vast. So I see public transportation from a busing standpoint, a very difficult prospect for the service here. But I mean, look, we can look at all. That just seems tough.
I agree. I have to agree. I mean, because with us, with doing the Office for the Aging, it's very tough because there's no turnaround. So if you're gonna have bus stops, these people don't, as they get older, they're not driving. So that's why they want transportation.
I do think that, having been a caregiver or whatever, but I know I'm not there's other people that would not be able to do this, but if we were able to put something in place, then, and it was so much closer for the people to get to, it's probably easier for some of the caregivers or the neighbors or the friends or the family, whatever, to take time off from work or whatever, to get a person to a bus stop rather than get them all the way to Binghamton, Oneonta, Cooperstown, wherever. Unless they already, they need someone to be with them for that appointment, which often happens also. But driving 60 miles as opposed to driving 7 is still helpful.
Just to echo that a little, Dot, this is Kent. I think certainly you guys talked about Prosser Hollow. If that route is embraced still to go to East Meredith, you have the fire department there, and you go down to like the Davenport, the garden center there in Davenport Center. I think that, I don't know what your ridership is, but I think that certainly would be, if this route is pursued, that would be kind of a small amendment to it, and maybe give folks an opportunity. Those are fairly easy places to meet. I don't know if the bus stops have to be specific areas, or if it's just kind of where the bus can pull off, and community centers like a fire department, I would think would be available.
Excellent. That's all.
I guess my other question, Webb, is there funding within this funding that's available for people? Would there be funding like for municipalities to help with that more local door-to-door transportation, somehow, or some kind of a group like Deposit Foundation right now that has something for deposit people, but is there something in there that could be built in to help maybe with this door-to-door issue?
Yeah, so that's I think a good question, and that's going to be part of kind of our last piece of work for this project. We'll be thinking of how local funding works. So all funding could come from the county. Perhaps there are some municipalities that would be able to pay into a system as well, because there's this like local match basically that we'll have to think through, like where that money actually comes from. So I do think it's definitely on the table that local municipalities would help.
Okay.
Okay, all of this feedback has been really excellent and is totally useful for our project. So maybe, not attempting to do that, I'll turn on our next route, which is also quite long in distance. And I definitely take the point that, these are routes that would have pretty long travel times, but I do think that is just kind of the reality of the space that we're looking at. So this route would be between Hancock, starting in Hancock, Deposit, and then going up into Sydney. And this would probably be a route that only makes one run a day. So probably starting in the morning from Hancock to Deposit up to Sydney, and then probably waiting in Sydney to make a return trip in the afternoon. So curious to hear thoughts on this one as well.
First of all, what are all these symbols here? There's like the purple is a house, star. What are all those symbols? Emergency, is that what they are? I can't see it because it's blocked. Okay.
Yeah, sorry about that. That was gone. So we've these are, we've taken some of the county's planning documents and just mapped them. So it's medical providers, shopping destinations, low income housing, major employers, senior facilities, and youth facilities. This list might not be like totally comprehensive, but it's just given us a sense of where activity centers are clustered.
The one thing, go ahead, I'm sorry.
So you're saying on this route from Hancock to Sydney, we're doing it possibly just like you're just looking at doing it once a week?
Not entirely sure about the schedule, because part of what we'll do here is, think about like demand, and if potential ridership is high enough to justify doing it multiple times a week, perhaps we would do that. But I think probably safe to assume this wouldn't be every day.
Yeah, I don't see it to be a need to go to Sydney every single day. Do you, Dottie?
No, and in fact, I was going to say that we have a lot of patients coming from the Hancock Deposit area to our hospital, because in Sydney, there's only a ER. There's
Correct.
no hospital per se. So we kind of need something where maybe from Deposit, they come across on 10 to Walton, or, you know, at some point, which connects the two, I don't know.
Well, outside of medical transportation, we do have, Sydney, we do have some large employment center. So
yeah.
we will have
Right.
folks who are going to be using this, I hope, for employment. So, that would speak to the need to have something on a, if not a daily basis, then something closer to that.
Right.
Are we gonna be doing like a needs assessment or getting people's feedback about using this somewhere along the line?
So part of the project is interviewing potential customers of a public transit service. We would love this group's help in finding names for people to talk to. Unfortunately, we only have a couple so far, so I can follow up again after this email. So we're doing specific rider interviews just to ask, like, would you be able to use this kind of service? And also just to learn more about their specific travel needs. But it'll be, we'll do our kind of independent modeling of demand estimates for these routes along with the rider interviews.
So Ray, would this be something like, is there a way you can do get some feedback from like Amphenol, or well, it used to be Keith Clark's, in that area, to be willing to possibly use this mass transit to go to?
The HR director at Amphenol had originally planned to join us on this call, and Sherry will get a recording of it. As some of you may know, one or more of the unions at Amphenol right now are on strike, so she's got her hands full a little bit. And is unable to participate in today's call, but Amphenol certainly is one of the focal points in this.
And they do also have some shopping and stuff over there. People may want to go shopping over there. I know they have Price Chopper and a few other things. So yeah, I think it's.
Oh, yeah, absolutely.
Yeah.
Yeah, I think it's helpful for us to note that the Hancock Deposit communities also need a medical connection to Walton. So maybe we can think about like the best way to do that. So we've definitely got that note.
And again, that doesn't have to be every day,
Yeah, that makes sense. Like perhaps if it was a fixed route, perhaps it could be, alternating days, or perhaps, one of these other services might fill that need as well. So I'll turn on this other one that we've been looking at, which would be, and I'll turn this off just so it's more clear, between Downsville, Walton, and Sydney, which would also serve Masonville on the way. Any thoughts on this route?
So it's good that you go from Downsville to Walton, because again, I think that would serve the medical need there for Dottie, if I'm not mistaken. Correct, Dottie?
Yeah, that does help us, yes.
And then it's good. And then from there to go to Sydney, to Masonville, it all depends.
I guess they could pick up, like if they're going shopping to say Price Chopper, which I think a lot of them do, they either go Sydney or Delhi. They could pick up, the other one going up the Route 10 corridor to Delhi from Downsville, or go over to Sydney. And then from Sydney, they can always go to Oneonta from what we've seen, even with what's existing, according, to what Al was saying with Oneonta Transit, taking people from Sydney to Oneonta.
Al, is there somebody that transports from Sydney to Oneonta every day?
So I'm not sure if it's scheduled every single day. What we've learned is that the current service between Sydney and Oneonta is quite limited. So some non-emergency medical transportation providers have tried to use that for their patients, but because of the route and just because of limited schedules, it's been kind of minimally useful. So we do think that there are some, adjustments we could request and perhaps fund through Delaware County that would make this service more useful for residents of Sydney. And then that also obviously would be a kind of useful connection point in Sydney from Oneonta if that existed, and we would want to coordinate that with services coming into Sydney. So that's just to note that these, are the ones we've been thinking about in terms of fixed route services, which we think are more appropriate for longer distance travel. So I've got a note about, serving Johnson City and Binghamton. Any other thoughts, I guess, on like what this map looks like before I get into the next category of services we're thinking about, which are these like barbell flexible services?
I don't know what the population is like up at the eastern end of the county because we don't serve that area very often. So, but they look a little, like we're not servicing them with this plan at this point. So I don't know what the situation, I can't really speak to it, but.
Yeah, so we definitely want to think about services for the eastern end of the county. The reason they're not included in, we have them included in our other service alternatives.
Okay.
In terms of fixed routes, we thought that it would just be getting to the point where it's a pretty long trip to get from Margaretville, for example, up into Oneonta with stops in other towns. So that's why we don't have it currently included as fixed routes. But maybe I can turn on actually all of the kind of barbell services we've been thinking about. So here, just to recap, the idea is the route would make stops or would make pickups within a certain area. So for example, would make pickups within Walton before making a run up to Delhi and making drop-offs within Delhi. So these are kind of the towns and route pairings that we're looking at currently. So maybe I'll just zoom out kind of on this image.
Pairings that we're looking at currently. So maybe I'll just zoom out kind of on this image.
Sorry, I'm getting some echo.
Sorry, I'm getting some echo, hopefully.
Okay, so I guess looking at this map. Ray, actually, do you I think that we're getting some feedback from your. Thanks. I think it was just some delay in the speaker kind of echoing back. Okay, so I will try to make this a little bit more, maybe this is the best view. So any thoughts, I guess, on kind of this layout with these town connections? And here's the list of town pairings that we're looking at. So I'd love to hear like which of these you think there's highest demand for, which of these there might not be demand for, et cetera.
So what are you looking at? Are you looking at, say, for over in the Margaretville area, Fleischman's area? So you're going to bring it over to Delhi, and then there's going to be like a hub there that they can pick up Delhi to go to Oneonta or Delhi to go to Harpersfield. Is that what you are trying to say, Webb?
So I think here the focus would really be on just trips between these two communities. And in my view, that's like how people would be most likely to use this service. That being said, once somebody from Margaretville got to Delhi, perhaps they could use it to connect to another town. Like that would definitely be an option that's available. But I think, kind of as we've been discussing, that starts to look like a really long trip that might not be too appealing. So I think we're really thinking about these as probably like a single trip that a person would make in a day, but they would have the option to connect to other services.
All right.
And Webb, one thing we should point out in here is Ulster County Transit starts in Pine Hill. So again, there may be the possibility of extending their service from at the top of Bel Air down into, into a Fleischman's or even into Arkville or Margaretville.
Thanks, Ray.
The other thing too is if they're going to connect, you have to think about the timing so that they don't get stuck in Oneonta and get back to Delhi but can't get to Margaretville, because they didn't connect correctly in time. The only, again, I would say that we need a hub in Hancock. I think that Hancock area has some of the poorest people in the county, frankly. Or at least traditionally they have. I can't say that I've quantified that with the 2020 census, but I do think that they're a group that, there's a lot of elderly down there.
Well, interestingly enough, a couple years ago, when the feds were rolling out those opportunity zones, Hancock was not on the list because they were not economically eligible.
Yeah, because they have some people that have
Things
moved
that may have
in.
improved.
They have improved because they've had some people that have moved in and have fixed that, but there's still a lot of people down there.
So maybe looking at Hancock specifically, and sorry, there's not a zone around Hancock, but we'll add that to our map. We were looking at a service between Hancock and Sydney, but perhaps it would be more useful to do a service between Hancock and Walton, understanding like the medical need, and that's also a shorter trip, so it might be more appealing to people. So maybe that's something that we could think about adding to our list. Does that make sense?
I think it might, I don't want to be the be all send all, because obviously we have to check with people, but I think that could be beneficial.
So also, Dottie, am I correct? And also is that, I know that a lot of people down the Hancock area not only come to your place for medical, but also because there is no hospital setting down there. So Hancock Deposit, they head to Binghamton because that's where they have to go to the emergency room or hospital setting. Am I correct?
Yeah, they come here. Hancock, a lot of them are coming here at this point. A lot of that has to do with our new CEO, frankly.
Okay, sure.
But they do. They do head toward Binghamton for a lot of things, and it's not just UHS. It's Lourdes, is down there also. But we are doing more at Delaware Valley than we ever have. So I think we're bringing more specialists here than we have in the past. So I think it's going to, looking down the line, it's probably going to be more so that we can keep people at least somewhat more local more often.
Right.
The one thing I do want to note, and I don't know if it makes any difference or not, but half a deposit is in Broome County and half is in Delaware.
Correct.
So when you're writing a grant and I don't know if that matters. So I just want to point that out because I don't know if you realize that. So
Dottie, do we know, does Broome County come into deposit? They used to have transit that come down there, or did they do away with that? Do you know?
I don't think they have it, but I don't know that for sure.
Yeah, I can't.
Al, do you know by any chance?
I do not know. Nope.
Yeah.
So one question I'd be curious to hear this group's thoughts on, looking at this list of services over here, which are basically just pairs of towns, are there any of these that you think like aren't useful, or any that you have a hard time imagining someone taking? So Walton to Delhi seems like kind of big to me. Hancock to Sydney, we discussed maybe it makes more sense for that connection between Hancock and Walton rather than Sydney. Perhaps the same for Deposit. I guess, does anybody have thoughts on like just what these pairs are?
The only thing I'm noticing is we've left Franklin out completely. It's in the middle of the county and nothing is going there. I don't know if perhaps that Delhi to Oneonta could swing over to Franklin to Oneonta as opposed to going over to Meredith. I don't know, but I'm just saying I'm noticing Franklin is completely out of the loop here. No pun intended.
Or what if they went from Walton Franklin to Delhi?
Yeah, I mean, any of those could work. I just noticed that we just don't have anybody, and I think Franklin also has a high senior population, if I'm remembering correctly.
Yeah, unfortunately, with our bus and stuff, there's not a lot of people over in that area that utilize it, so I don't know.
Okay.
But that doesn't mean, it can change tomorrow.
Right, I know.
It's funny that, we're adding on to go up into Albany, and it's low. Our bus is now loaded. I don't know whether it's because of the cost, but almost every day now, wherever we go 3 days a week now, wherever we're going, it's full. And I know the bus is smaller. It only holds 14 passengers, but it's full now. We even have a waiting list. Where prior to this, a couple months ago, we didn't have the waiting list. So I don't know why. But definitely knowing that going to Albany, the seniors are definitely wanting to get back up there, and we're going up there. I think we'll
That's
for the next November and December, we're going up there twice a month, minimally, for the next 2 months.
Wow. Well, the other thing too, I can say, like in terms of the healthcare, and again, I don't mean to harp on healthcare because I know this whole purpose was not about healthcare.
Correct.
Being the rep for healthcare. The other thing I can tell you that we're finding is the lack of beds. So I mean, when we have to transfer a patient, we're transferring them all over creation. So, you know, a lot more are going out of the area than ever were before. So, you know, Bassett will be full or UHS will be full. So they are going to Albany. So we've even, I'm not saying that we should cover the transportation to these places for the family or anything, but I'm just saying, you know, we've had to send people to Westchester Medical, New Jersey. We've taken people from Cortland and Westchester. So it's been crazy ever since the staff shortages that were, you know, created because of the pandemic. So the lack of beds is a huge issue for a lot of people, but that's another whole problem, you know, that we can't solve with this.
Well, when I say going to Albany, it's not 100% medical appointments. They're going up there. They want to go to the malls. They want to get up
The shop.
The shop. It's from the Margaretville, Arkville, Stanford area. That's where they want to go. They booked the bus.
Don't tell Wayne, don't tell Ray that. They're going to Albany to shop, right?
I know, but you know what? There's nothing over that area to shop except to go up. They have to go out of county. You gotta
So
get up
you're making
north.
me cry. You're making me cry here, Mr. Shepherd.
I'm sorry.
Just a quick note, Broome County Transit does go to Amphenol in Sydney.
Oh, they do.
Oh, that's
Amphenol.
good.
Yep, it does. At least that's what it says on this site that I'm looking at here. So Amphenol is their stop.
Okay.
But not to pause it.
No, it's not even, it doesn't even say Sydney. It specifically goes just to
The Amphenol.
So maybe just because we have a couple of minutes left, I'll briefly show the microtransit alternatives that we're looking at. So one is Margaretville to Fleischmann's, which we've heard, you know, there's some demand for travel between these areas. Also, there might be some tourist demand for travel here. And then the other, which let me see if I can find, would be this corridor between Delhi and Walton, Delhi, excuse me, and Walton. Delhi, yeah, not Delhi.
We're not going that far. You don't have to get them to India.
I think we can rule that one out. Yes,
And I don't want to say, but you know, you've got to send Australia over there on number 4.
the number
Oh,
4.
yeah, it's SID. Anyway,
SID.
SYD instead of SID.
Oh, SYD. Okay, let me actually. We're looking at some long distance trips.
Yeah, air distance.
Thank you. I'll make that.
Sorry, I'm
correction
not here to be
throughout.
picky.
So these are the two smaller zones that we're looking at. Basically, kind of the criteria that we look at for microtransit is is the zone compact enough for trips to be relatively short and relatively efficient? And are there enough people traveling in similar directions that we could, you know, have a lot of sharing happening? Because that's really the goal with the microtransit system, is to get as many people in the vehicle at the same time as possible. So those are the two zones that we're looking at, just because of kind of the spatial dynamics of the county. But then the other service that we're looking at is, as I mentioned earlier, just a county-wide service that would probably require people to book kind of far in advance, understanding there would probably be a lot of demand for a service like this. But this kind of, you know, skips a lot of the questions we've been thinking about, like what places are most important to serve, because the service would be available everywhere. This, of course, has the potential to be more expensive than other options we've looked at, just because it's quite large and would go a lot of places. But with this kind of service, we could think about perhaps 1 day a week trips are available to Oneonta, or 1 day a week there's a shuttle to Binghamton or something like that. So that's kind of just to put this on the radar. And sorry, I do realize we've kind of come up against time here, but this has been really useful feedback so far. The one thing I'd like to note, we've gotten a couple of comments in the chat saying that it would be useful to do some kind of surveying, just to give the public an opportunity to provide more input on what services they would be likely to use and what would be most useful. I think that's a good point, and something that Miki and I can discuss with Ray. So Ray, maybe we can plan to talk about that at our next check-in meeting, because I do think it would be useful just to have another opportunity for people to provide that level of input. But yeah, any concluding thoughts, I guess, on these? Sorry that we've kind of run out of time here.
Well,
Yes.
I have to agree that if you do a survey, you have to do I think you need to do some type of survey to get the feedbacks people out there, because that'll help us, because you've got what, 6 of us right here.
Yeah.
I think you need their feedback, because that's going to give you a better idea of what people are looking for. Do you know what I'm saying?
Mhm.
Can I ask a quick question? It's Joe from the Arc of Delaware County. I got on a little bit late, but would any, we're always looking to be able to expand our workforce and get people to back and forth to work. Would any of these trips be daily, or are we all talking about weekly or semi-weekly trips? If it's not a weekly, or if it's not a daily trip, I don't know how we could possibly utilize the service. I'm assuming that if they're running a bus to Amphenol, it's every day to take employees there, right?
I would assume it is. I would agree. And I think what we discussed on this a little while ago is that we're not here just for the medical services. We're here for all services.
Yeah, because I just think that we and Arkville especially, we do have one. We have a day program in Arkville and a residence in Arkville, and we have a heck of a time getting our people back and forth to program, as well as getting our employees back and forth there.
Right.
But again, if it's not regularly scheduled, I don't know how we would be able to utilize the service. We need to kind of be on a schedule, and it would have to almost be, at least weekly, during the week.
Yeah, Joe, it's right. The workforce is an absolute key element of that's why we're involved at the chamber, because this is a workforce issue. So absolutely, we're looking at something that supports workers on a daily basis.
Okay. All right. Again, I apologize. I got on a little bit late, but I just want to.
Joe, I've been recording this, and I'm going to be sending you a recording so you can catch up on the first half.
All right, great. Thank you very much.
Great. So I think, this has been really useful. We got a lot of good input, and I think we have some pretty clear next steps just to do a little bit more of this work and get more input on which alternatives are useful. So we will meet with this committee again over the course of this project. By the next time we meet, we will have gotten some more information, hopefully from potential customers of service, about what services would be most useful, and we'll also have some demand estimates using our methodology for estimating demand for public transit. So I will wrap this up just to be respectful of everyone's time, but please feel free to email me if you have any follow-up thoughts from this conversation. I can send my email on the chain that we're all on with Ray. But thank you everybody for your time today. We really appreciate it.
Webb,
Yes.
what's the possibility of getting some of the slides that you just sent? Can you send our way so we can look at it and digest it more?
I'm happy to send these slides around.
Thank you.
Thank you. That'll be helpful.
Sure.
Thank you, everyone. Send those comments, send people, and we'll be in contact with when we're going to meet again.
Okay.
Great.
Thanks,
Thanks,
Ray.
Ray.
Right. Thank you.
Bye-bye.
Thanks, everyone.